Everyone explains peptides the same way. Peptides are short chains of amino acids. That's great. And a book is a stack of paper. That does not tell you what it means. Every peptide video seems to start the exact same way. Peptides are short chains of amino acids. Okay, that is technically true. But it is also almost useless if we're trying to understand medicine. That's like saying a book is paper, a song is sound, a car is metal, a human being is made of cells. All are true, but very incomplete. Because the real question is not, what are peptides made of? The real question is, what do peptides do inside of human biology? And more importantly, how do they fit into medicine? This is where most peptide education fails. People memorize names. They memorize categories, memorize protocols. They memorize claims. This peptide for injury, this peptide for fat loss, this peptide for inflammation, this peptide for sleep, this one for brain fog, and this one for anti-aging. But at Praxis Peptide Institute, that's not where we start. We start with 3 words: pattern, signal, and system. If you understand those 3 words, peptide medicine starts to make sense. Let's define each of them. A pattern is a story the body is trying to tell over time. Not one symptom, not one lab, not one bad day, not one complaint. A pattern is a relationship between symptoms, timing, history, labs, medications, lifestyle, stress, sleep, metabolism, immune activity, injury, and the response. For example, fatigue is not a pattern. Fatigue after a poor sleep, with weight gain, cravings, elevated fasting insulin, low recovery capacity, and afternoon crashes, that starts to become a pattern. Joint pain is not a pattern. Joint pain after injury, with swelling, limited range of motion, poor sleep, and slow recovery, that starts to become a pattern as well. Brain fog is not a pattern. Brain fog after meals, poor sleep, chronic stress, inflammation, and metabolic dysfunction, that starts to become a pattern as well. The pattern tells us what kind of problem we may be looking at. Is it metabolic, inflammatory, hormonal, immune, neurologic, gut related, tissue repair related, stress related, maybe recovery related, or something that needs proper medical evaluation? This is why one protocol cannot exist for every patient, because 2 people can have the same symptom and have completely different patterns. 2 people can say, I am tired. One may be undersleeping. One may be insulin resistant. One may have thyroid dysfunction. One may have anemia. One may be overtraining. One may be inflamed. One could be depressed. One could be on medication causing fatigue. One may have sleep apnea. Same symptom, different pattern, different decision. That is why Praxis does not teach peptide medicine as symptom matching. We teach pattern recognition. Now, let's define the second one: signal. A signal is a biological message being sent. Peptides are not magic molecules. They're not shortcuts. They're not hacks. They're signals. A peptide may signal appetite regulation, glucose control, tissue repair, immune regulation, inflammation resolution, gut barrier support, growth hormone release, mitochondrial adaptation, neuroendocrine rhythm, stress recovery, collagen remodeling, vascular response, and we keep going. But the key is this: a signal only matters if it matches the pattern. If the pattern is metabolic dysfunction, the signal may need to address appetite, glucose, insulin resistance, visceral adiposity, liver burden, or metabolic flexibility. If the pattern is tissue injury, the signal may need to address inflammation phase, blood flow, collagen remodeling, load tolerance, and repair timing. If the pattern is immune dysregulation, the signal may need to address tolerance, inflammatory tone, neuroimmune communication, or just immune balance. If the pattern's poor sleep, stress overload, the signal may need to address rhythm, recovery, autonomic tone, or neuroendocrine regulation. This is where people get peptide medicine wrong. They ask, what peptide is best? That question is incomplete. Best for what pattern? Best for what symptom, system? Best for what system? Best at what phase? Best for which patient? Best with what risks? Best based on what evidence? Best monitored by what outcome? A peptide signal without a pattern is just a guess. And a guess with confidence is still a guess. Now, let's define the last one, systems. A system is the larger biological network receiving the signal. This is the part almost everybody skips. A peptide doesn't enter an empty body. It enters a system, a metabolic system, an immune system, a nervous system, a hormone system, a gut system, a vascular system, a liver system, a connective tissue system, a recovery system, a patient with medications, a patient with sleep debt, a patient with stress, a patient with inflammation, a patient with trauma, a patient with insulin resistance, autoimmune history, cancer history, liver or kidney considerations, a patient with different genetics, goals, risks, and capacity. So when someone says, just use this peptide, the question should be, what system is that peptide entering? Because the same signal can produce different responses depending on the state of the system. A repair peptide in someone sleeping well, eating enough protein, rehabbing properly, and managing load isn't the same as a repair peptide in someone inflamed, sleep deprived, overweight, undernourished, and still stressing the injured tissue every day. A metabolic peptide in someone protecting muscle, eating protein, hydrating, monitoring digestion, and resistance training is not the same as a metabolic peptide in someone undereating, constipated, losing lean mass, and not tracking anything. An immune peptide in someone with a clear immune pattern and clinical oversight is not the same as an immune peptide randomly added because someone online said it boosts immunity. The system determines how the signal is received. That is a praxis model. Pattern tells us what story the body is telling. Signal tells us what message we may consider sending. And system tells us where that message is going. And the decision comes from understanding all three. Not just the peptide name, not just the symptom, not just the mechanism, the pattern, the signal, and the system. Now, let's make this a little more practical. Someone says, what peptide should I take for inflammation? Praxis asks, what kind of inflammation? Where? How long? What triggered it? Is it acute or chronic? Is it immune, gut, metabolic, joint, neurologic, vascular? Or is it autoimmune related? Are there red flags present? What labs are present? What symptoms are paired with it? What has already been tried? What medications are involved? And you got to ask, what would improvement look like? That is pattern. Then we ask, what kind of signal would make sense? Do we need immune regulation, inflammation resolution, gut barrier support, tissue repair, microglia calming, metabolic correction, stress downshifting? That is a signal. Then we ask, What system is receiving that signal? Is the patient sleeping? Are they eating protein? Are they hydrating? Are they moving appropriately? Are they overtraining? Are they under-recovered? Insulin resistant? On medications? Autoimmune prone? An active disease present? Are they at risk? That is their system. Only then does the peptide conversation become intelligent. That is why patient peptide mastery exists, because patients are being flooded with peptide names, protocols, claims, influencer stacks, and before and after stories. But most of them are never taught how to think. Nobody's taught how to organize their symptoms. You're not taught how to recognize patterns. Never taught how to understand what a peptide signal actually means. Taught how to ask if the body is ready to receive that signal. And no one's ever taught how to track if the system is actually changing. Patient peptide mastery was built to fix that. Not to turn patients into reckless self-prescribers. Not to replace qualified clinicians. Not to encourage random peptide use, but to help people become organized, educated, and harder to mislead. Because healthcare across this country needs better patients and better conversations. Patients should know how to ask, what pattern am I seeing? What system is involved? What signal is being considered? What evidence supports it? What risk matters? What should be monitored? What would tell us to stop, continue, or reassess? That is not hype. That's health literacy. And peptide medicine desperately needs health literacy, because the future of medicine is not going to be one universal protocol for everyone. And it's not going to be this peptide for that symptom. It's not going to be memorizing more names. The future is pattern recognition, signal interpretation, system understanding, personalized decisions, and better monitoring. Woo. So yes, peptides are short chains of amino acids, but that definition is the first sentence, not the education. The real education begins when you understand that peptides are biological messages, and medicine is the art of knowing which message belongs in which person, at which time, for which pattern, inside which system. That is a Praxis standard: pattern, signal, system. Because peptide medicine needs systems, not hype.